Good afternoon. We're here today with Mr. Wayne Norris, the Managing Director of Noble Mineral Resources, an Australian publicly listed company that currently has operations in Ghana. And he's here today to share some of his stories about the problems of malaria that they have in Ghana associated with the mine and the productivity of the people involved there. So.
Thank you very much, Alan. Good to be on and talking about the problems that we have in malaria. Our mines are located in a very tropical environment, obviously conducive with a lot of malaria and mosquito breeding in that area in Ghana. Noble purchased the mine in 2009 from Investec Bank, and along that came 460 employees that were with the previous company. And the malaria problems within the mine site and other adjacent mines to Noble all over Ghana, West Africa, that there is no real controls. They've tried the net programs, they've tried the repellents. I guess they've worked in a sense in a small fraction of the areas, but again, it's not a good system to do that. They're not utilising those devices that are available in a lot of conditions. So Tunku Nakwayuden, our chairman, obviously, who's associated with your company, said to me at the time, what can we do to mitigate this risk that you have in the loss of employment time at work for your employees? And it is quite a few per month. We have all the statistics for that. Obviously, I agreed with Tunku that it's very detrimental to anybody who's producing, whether it be a mine or a workshop or anything in this sort of environment. The loss to us in productivity is large, as our other companies are finding in Ghana and West Africa and probably all around Africa or anywhere with the malaria problem. So we've instigated the program. It's been active now for over a month. We are going to the second stage of the trial now, and at the moment, just myself over the last 6 weeks in Ghana, West Africa, I have noticed a reduction already, albeit it's not noted as public results as yet, but just on our drilling crews alone, we've had the last 6 weeks where there has been no individuals out of a team of 35 to 40 people. We have no lost time due to malaria and no relevant cases reported on the site. Some cases reported, but we are quite sure that these cases are from people visiting other areas in Ghana, West Africa, and perhaps coming back with a malaria virus. So certainly not contracted at work, and I think in due course, by October this year, and after the second treatment of the site area, I think we'll see a remarkable reduction.
Well, that's really amazing. How many people do you have working there, and how many people are in that location?
At the moment, we've got around 520 people directly employed on the mine site. Obviously, within the environs of the mine, you have around 25 to 30,000 people. At the moment, directly involved in predominantly your night shift focus are the drilling team, and they alternate on 12-hour shifts, days to nights. The least amount would be 15 on a night shift, and then you've got a geology team that also supports them. During the night would be another 4 to 5 people. So you're bordering 25 to 30 people at best. And so far, no cases over the last 6 weeks. So it's certainly not pure luck.
Well, mosquitoes obviously need water to reproduce in, to lay their eggs and their larvae to grow in. How much water is in the neighborhood of the mines?
There's a massive amount of water that surrounds the environment of the mine, albeit old tailings dams from bygone years, from the 40s, 50s, 60s, that's still there. It's still, I guess, prevalent right around the township, where you would directly affect at least 7,000 people, including our employees. So you have tailings dams, you have water retention ponds. So it's a huge area of the mine that we're trying to cover. Area-wise, probably 4 or 5 square kilometres of water within the town and mine boundaries where we operate.
And what did you do to control the mosquitoes?
Basically, the new product from your company,
MOUSTICIDE.
the MOUSTICIDE, is exactly what we've put out there. There's other ancillary spraying, obviously supplied by your company. We've also got the repellent supplied by your company.
The Bio-D.
Yep, free of charge for trial, I guess, which is fantastic for us and the people of Ghana. The people are using that predominantly on your night shifts. Again, the mosquito, which is typical, they're around at dusk and they're around at dawn in their millions, no doubt, with Bibiani. You could stop at any pond and see the larvae anywhere on the mine site.
Continuing with Wayne here, is malaria treated in Ghana? Do they go to the hospital? How many people are going there? And
as far as the treatments go, it's normally a visit to the hospital, and they do a check, centrifuge check, blood check, basically to make sure that yes, you do have it or you don't. 9 out of 10 the treatments for the Ghanaian nationals and all the expatriates, but predominantly Ghanaian national, is via injection, anti-malarial, I guess. The other treatment is the artisanates that are obviously fabricated in China and readily available in Ghana from any of the clinics and chemists and the hospitals. In turn, the expatriates the same. That you get a travel pack, and there's a lot of companies that do it. Noble do it, Newmont, Goldfields of South Africa, Golden Star Resources out of Canada, to name a few that are in Ghana operating in our areas. I guess I've been in Ghana for 9 years, and predominantly the treatments that I've used, I've lost count, but let's say 9 or 10 times or more.
Really?
I treat the symptom, and the symptom treatment is an artisanate or another product, coatum. Ultimately, that's the best way to treat malaria, is don't wait till it's really bitten you and got a grip on your body and obviously degenerating your health.
The parasite level as well.
Yeah, exactly. Get it while it's low and you're feeling like you can actually cope with it. I guess a good example of that is that I've been there 9 times. I've had it that many times that I know when I've got it. A lot of the symptoms: headaches, nausea, vomiting, lethargy. So you're actually really down when you get up in the morning or the evenings. Normally in the evenings is when it'll hit you fairly hard, where in the morning you just don't go to work. So ultimately, the last 6 weeks being in Ghana back on site, as the MD, we're trying to get this gold mine up and running. So I'll spend a lot of time on the back shifts as well. So you're there at dusk and you're there at midnight or 4 a.m. in the morning to help the guys get everything progressing. And good classic example, you've got an expatriate Australian in Ghana, West Africa. Yes, I've been there for 9 years, but that doesn't stop you getting malaria. Guess what? I haven't had it. I'm using the repellents that your company has supplied. Prompt name of?
Bio-D.
Bio-D is the product that I've used. I've distributed that to the drilling guys that are on the night shift, and they freely put it on. One of the positives with that product is that they know that it doesn't have that high deep value of your other products that are normally used as a repellent to rub on. And all your sprays, I won't name them, but they're all pretty mean and nasty to your health. Your body overheats with that sort of product. With the Bio-D, there's no effect. You can smell the lemongrass, the coconut oils and things like that in it. Again, for an Aussie to put that on, it's better than spraying the harsh things that we normally put in our body. The Africans or the West African Ghanaian, to date, no problems putting that on. If they don't get bitten, they're happy with that. So, yeah, it's excellent.
So they can enjoy their time out there and not have to worry about getting malaria.
Yeah, exactly. I mean, and that's a big thing for them. If you look at the incidents, and it's not just the adults of the area that work for us, it's the incidents of children. We're in an environment around the mine, 7,000 to 8,000 people, and the predominant people that are getting that are the children, under 4 or 5 years of age. Super hard to protect a child, hard to keep a child under a net of a night time. As I said prior, the nets and things like that, well, it's something that you can't readily use. It's a saleable product if it's given to somebody, and that does happen. I mean, very entrepreneurial people in Africa, so for saleable product for a small entrepreneur, they'll sell it. So again, it's not being used as you would use it. So the MOUSTICIDE, the Bio-D as a backup product for that, I think will be fantastic. We just need to prove it. We're in that first stage. I think once we get through this second stage by October, early November this year, Noble will have a very, very good idea, as will Entomologists, on the product proof that it's working. I really think that it is. If I can go to Ghana in 6 weeks and be on night shift and not get malaria, touch wood, it works.
Oh, very good. Wayne, I understand that recently we received approval from the Ghanaian government, their EPA organization there, for registration for the MOUSTICIDE products. Could you tell us a little bit about how the application went and how it was done and what was done to assess the situation before the application was actually made?
Yeah. Ultimately, it was, again, as I've mentioned before, our chairman obviously involved, of Noble Mineral Resources, obviously involved with Intergenix as well. From there, we found a representative in Ghana, West Africa, that we term the Reverend, has his own business over there and obviously wants to grow this and protect the Ghanaian people, and rid Africa, or Ghana specifically, first. Ghana's first with most things in Africa, and if Ghana can actually prove that they're again at the lead of Africa to try and get rid of something as debilitating as what malaria is to the people. I guess the first steps were that, yes, there was a contract consultant that came to Noble, and we actually asked him to come across, and then he visited over here in Malaysia, obviously, and talked with Intergenix, and then said, right, let's get the product into Ghana. Noble was definitely willing to go ahead with this and finance it right to the end. Then EPA obviously was involved. Our site HSE department was fully involved with this. We took on an entomologist also, external, so that we could get all of the criteria and data that was available within the community, whether it be from the private hospital, clinics. We have our own clinic on the site. So everybody is fully involved in that, and ultimately, of course, to do that, you've got to involve the scientists in the development of the MOUSTICIDE product, and is it safe for humans to be around and utilise, and the Bio-D product included. Obviously now it has EPA approval in Ghana, West Africa, and I'm quite sure the Ghanaian government and the people of Ghana will be very appreciative to be number one off the block again, with setting an example for the rest of Africa.
Well, we certainly hope everyone has this, enjoys the success that you've had and continues in the future, and hope we can lead Africa to adopt the utilization of this actually remarkable technology. You went through and mentioned that the safety issue of it. That's true with any pesticide that has to be registered. It has already gone through the US EPA registration process with a very thorough toxicology study. It is an extremely safe pesticide, larvicide for mosquitoes, extremely safe, very compatible with the mosquito. It doesn't affect other non-targets. It's really an exceptional product. And to know that it's working as well as it does, it's absolutely amazing.
Yeah, I think it is. And this is one of the main points that interested myself when Tunku actually explained to me what it was about, how it was fabricated, the scientific toxicology test, everything that went into it just makes it a product that I'm quite sure any mining company that operates in West Africa would support. The detrimental effects to malaria on a mine site are quite large in Africa, and not just Ghana. I'm quite sure widespread across Africa. The man hours lost to this sort of thing is quite phenomenal. And we can notice that just at Bibiani. We've only been there since December 2009 with this mine site, but obviously we've been in Ghana for 9 years, and we've seen the detrimental effects of malaria. As I said before, it stems right from the young babies and younger children right through to the adults that have to earn the income to even pay for that sort of remedial action once you've got malaria. So very expensive to the country, and I'm sure that other foundations that get behind the product, and let's attack the disease of malaria. And I think Africa's a really good spot to start, and Ghana being number one, and our company being involved with it. Obviously we have the same chairman on both companies, and just a brilliant opportunity to try and combat something without using pesticides and toxic chemicals.
Very good. Well, we hope to make a difference.
Well, I think we will. I'm quite sure we're well on the path, and October can't come soon enough for us to sit back and say, this is what's happened at Bibiani in Ghana, West Africa. And I'm quite sure that if it's positive like I think it is working at the moment, then the rest of Africa will follow, like they normally do follow behind Ghana. So it'll be fantastic.
Thank you for your time and your support.
Alan, thank you very much.